So welcome to The Culture for a new video today where we're going to do part 3 of our shoulder stability series here. So if you haven't gone back and watched the first 2 videos or the previous 2 videos to this video, they'll be linked in the description. Here's the 2 thumbnails. I recommend going back and checking those out, otherwise this video might not have any context. But just a quick recap. In video number 1, we just generally talked about the mobility and stability demands of the glenohumeral joint, so the shoulder joint, through low bar squatting and bench press, and why some people feel anterior shoulder pain when they have high volumes or high intensity programs around low bar squats and bench press. In video number 2, we actually did a case study with Didier through some assessment processes that we use here at Melbourne Strength Culture, and we determined that Didier was presenting with anterior shoulder pain, more than likely in the bicep tendon, because of an inability to stabilize his glenohumeral joint in extension and external rotation, both of which are requisites to perform pain-free low bar squats and bench press. So then today what we're going to talk about is a few processes here that we go through in terms of activation and stabilization drills surrounding the glenohumeral joint, and how we actually managed to pretty much get rid of Didier's pain within about, how many sessions do you reckon? 2? Yeah. Pretty quickly. 2 to 3 sessions, we pretty much got Didier to a point where he had no pain anymore on his bench press, which was the aggravating factor for him. And this is the series of exercises that we went through to help stabilize his glenohumeral joint. So the first thing that we actually did was just a little bit of soft tissue work, so some just typical SMR, some foam rolling through the pec and the bicep on the right hand side. That was his sore side. Pretty much both of these muscle groups cover the anterior capsule of the glenohumeral joint, so they cover the shoulder. They're active stabilizers, which pretty much just means they're muscles, which means we can have some sort of transient effect or transient change as we do some soft tissue work. There's no magic to soft tissue work, but it can definitely create a little bit of a window where you get better adaptation for your training, because it can reduce pain, it can increase range of motion and all that sort of stuff. So we just did a little bit of foam rolling through the pec and a little bit of foam rolling through the bicep. I'll just overlay a little video on how we did those, but with a red ball and the barbell respectively for those. We then went through a little bit of an activation sequence with Didier. So the first thing we went through was activation of the serratus anterior. And the way we did that is we first went through an isolation movement. So we're going to isolate the serratus anterior with what we call a foam roller wall slide. I've picked this up from Eric Cressy. I'd recommend looking at his videos. We're going to set up in this position, and then we're just going to slowly roll that foam roller up the wall. What we cue Didier for this is, as he comes back down into his second rep, we're going to cue him to think about his shoulder blades wrapping around and upwardly rotating. So what I like to cue is that the armpits are moving up with the foam roller. What this allows us to do is it allows us to activate the serratus anterior through protraction and upward rotation of the scapula in a very controlled movement, so we can really think about what's going on through this. At Strength Culture, what we do when we are moving along stability sort of deficits with people is we first like to isolate the muscle we're looking to activate, and then we integrate it into a more specific movement to the bench press or the aggravating factor. So now then we took Didier through a yoga push-up off an incline bench. So a yoga push-up is just a push-up variation that allows us to drive a little bit more upward rotation and protraction of the scapula, which is allowing us to better stabilize through a range of motion. So now if Didier goes through a normal push-up, he makes sure that he gets his full reach and then goes all the way into upward rotation and protraction of the shoulder blades. So now we're integrating that serratus anterior isolation work into a more integrated movement. We have a few more moving parts. It's a little bit more specific to a bench press than just a foam roller wall slide, obviously. And we're actually allowing the shoulder blades to move in conjunction with a few other joints. Now that we've isolated and activated the serratus anterior, we moved on to the lower trap. So for this, again, we isolated first with what we like to call a half kneeling lower trap activation with stick assist. I have done a video on this before, so I'll link that in the description box as well. But through this movement, what we're looking for is a passive shoulder flexion moment up until the very top range, where we then try and pull the shoulder blade back and down across the body. What we're looking for is about 160 degrees of shoulder flexion, which is in line with the line of the lower trap fibers, and hopefully we can get some activation of that lower trap. Didier's nodding his head if Charlie comes around the backside here. So we're looking for a passive range. The stick is pushing up, and then at the very top of the movement, we're just looking to pull the shoulder blade back and down. And we should get a pretty aggressive feeling on that lower trap on that one side. I would recommend doing this for both sides. But again, once we isolate that lower trap and we start to get the feeling of what it feels like to be active, we then integrate it into a more specific approach to the bench press. So for us, it was a supine band pull apart. So for this, we're going to set up exactly like Didier would have bench press. He's got a nice big arch, his head's on the bench, his feet are active, and everything's nice and stabilized in regards to his legs and trunk. And then from there, we're just going to go through a normal band pull apart. What we did is we cued a bit of an isometric in that bottom position for him to have a bit of time to feel the actual lower traps in this position. We also want to make sure that there is no pain in the front of the shoulder here. What we can normally do if someone still presents with a little bit of pain in the front of the shoulder in this exercise is we can stay in that position and just try to reposition the shoulder blades to a point where that pain dissipates. And it should almost happen instantly. And then that's the range that we need to start to train the bench press in. So once we did that, we unrack the bar. And trying to integrate that same feeling of the supine band pull apart, we need to now do exactly the same thing with the barbell. So here we have Didier just moving through a very slow tempo barbell press where he's feeling the shoulder blades and the lower traps in that movement. Now, obviously with far better stability through the scapulothoracic and glenohumeral joint as a result, where it's pain-free to a point where we can then train. So again, just to reiterate, we did a little bit of soft tissue work just through some of the active structures at the front of the shoulder. We then went through just a series of isolation and integration activation drills for the serratus anterior and the lower trap. These muscles allow for better stability of the scapulothoracic joint, which then has a flow-on effect which helps stabilizes the glenohumeral joint and helps to control that ball sliding, gliding, rocking and rolling in the joint a little better and keep the ball on the socket. If you have any questions, drop them in the comment section below. This series has actually got really good feedback, so we're probably going to look at a few other little niggles across the coming months and attack them in the same sort of series that we have here. So if you have anything that you want us to run over, just drop them in the comment section. You can find all of our links to social medias and everything in the description box. And as always, happy lifting. Make sure to subscribe too. That'll help us a lot. Get us to 2K. Thank you.